Physiowebseries Neurological Anatomy Season 1. Let's begin with Series 4. In this series, we will study about lower limb dermatomes. We will have look one by one over the lower limb dermatomes. In previous series, that is Series 3, we discussed about upper limb dermatomes. So now let's continue with lower limb dermatomes in this series. As can be appreciated over here in this diagram, till T12 we have finished. Now we'll continue from L1 to S5. This central diagrams number second will be considered further in the series to understand about the dermatomes. As we can see, we have L1, L2, L3, so on till S2 over here. Same way in the posterior view, this one posterior view also starting from the back part, covering buttock area and the lower leg, thigh and the lower leg, till the dorsum of the foot. In posterior view also we have those lower limb dermatomes. So the last diagram, the third one, which we had seen in previous series also, if we assume the human body in this position, in this particular position, it is easy to remember dermatomes. So till T12 we had discussed in previous series. We have to start this way, go down, then take a U-turn upwards again, go from here and then end by descending down up to T12. So that was about cervical and thoracic region. But in this series, we will focus on lumbar and sacral regions, which will be this way. So L1, L2 this way, whole part till S5, lower limb dermatomes we will discuss. So let's see one by one about lower limb dermatomes. Starting with L1. So L1 portion, if we consider this diagram, we can see over here and over here. So there is back, we can appreciate over here, over the trochanter starting from here, and the groin region is also covered. So in those diagrams we can see over here the L1 is there and here. So slight back portion, then over the trochanter over here and over here we can mark it, and the groin part. So this is the L1 dermatome. Then coming to L2 dermatome, again we can see the back portion over here, then front of the thigh to knee. See in this diagram we can appreciate front of the thigh till knee. So this is the L2 dermatome. Back, then front of the thigh to knee. So it is descending slowly down this way. So L3, again the back portion is there, can be seen over here, and it is upper buttock, slightly the upper buttock portion is covered. Other than that, anterior thigh is covered in L3. We can see slightly, we can assume over here and also over here, the central portion of thigh. So anterior thigh is covered, and also knee. So anterior thigh and knee are covered. Here we can see knee is covered in L3 dermatome properly. And medial lower leg. So you can see over here the medial lower leg is covered in L3 dermatome. Back, over here we can see anterior thigh. So if we discuss, it is this back, and then upper buttock can be well appreciated over here, anterior thigh over here also, and the knee, and also the medial lower leg. Now going to L4. So starting with L4, we can see there is medial buttock area. So L4 is over here, descending till here. So there is this buttock region. So starting over here, so the medial buttock portion is covered in L4. Then lateral thigh, we can see it is little laterally, starting from lateral side. So lateral thigh, the thigh portion which is covered is mainly laterally in L4 dermatome. So there is this lateral thigh, medial leg, because it is cross. So while coming down, it is medial leg. So this is lateral thigh of L4 dermatome, and this below will be medial leg or lower leg. So lateral thigh and medial leg of L4 dermatome. And then in this diagram we can see there is dorsum of foot and big toe over here. Correct? So after descending, see here also we can see big toe and this part of the foot, as well as in posterior view we can appreciate. So here is L4 and here is L4. In those diagrams also we can see there is this medial leg and this foot part, big toe. Here also we can see about the L4 dermatome, well appreciated in this diagram. So rebrushing L4 dermatome, it is this medial buttock, can be appreciated over here. Then lateral thigh over here, this will be lateral thigh. Then continuing downwards, the next part will be medial leg, and then again next is toe and dorsum of foot will be well appreciated over here and here, the toe and dorsum of foot. So that's about L4 dermatome. Then coming to L5, now we were at the back area and then we were at the medial of buttock region or upper buttock region, as can be seen in L3, which is at upper buttock region. Then L4 is can be appreciated over here at the medial buttock region. Now L5 we are descending, like going more downwards. So now we are covering the buttock region in L5. So over here you can see this is entirely L5. So you are covering the buttock region. Then posterior and lateral thigh. So here only we can see in posterior view, posterior part, and also this is lateral part. So thigh, there is posterior and lateral thigh. Then lateral aspect of leg can be seen over here. This is the lateral aspect of leg. And then dorsum of foot can be appreciated over here. Dorsum of foot, medial half of the sole and medial half of sole and first, second and third toes. So here you can see there is this first, second, third toes. Mainly the big toe is for extension, is for L4 dermatome, and L5 we can see that first, second and third toes are covered in L5 dermatome along with dorsum of foot plus medial half of sole. So can be well appreciated from those diagrams. Certain dermatomes we can find they are overlapping. That was about L1, L2, L3, L4 and L5 dermatomes. So we can see how they are descending downwards. This part we have to consider mainly the buttock region to use as marker, where that dermatome is at the thigh region, where is it at the knee. So we have to consider the lower limb, parts of the lower limb, and remember the dermatomes. Whether the dermatome is somewhere around the buttock region, somewhere around the back region, whether it is covering the thigh. If it is covering, then which portion of thigh? Is it crossing knee? Where is it at the lower leg portion? Then how is it covering the foot part, the dorsum of foot, and which toes it is covering? So all those questions we have to remember through this diagram to answer it easily. After this, continuing with S1, after L5 continuing with S1, so we can see the portion of buttock again in S1 we have now buttock. From L5 also we were having the buttock portion, and S1 again descending. So buttock is being covered in S1, and also the thigh and leg posteriorly. So we can see here S1, the posterior thigh and the posterior leg region. The lateral side it is covering over here. So posteriorly you can see the last two toes and also the portion of foot, dorsum of foot. Almost this area it is covering. So we have posterior leg, posterior thigh coming this way. So these are the parts of S1. Over here also on the lateral part it is. So now that was about S1, the buttock, posterior leg, posterior thigh, and then posterior leg, and over this lateral part to little toe. S2 is also considered same as S1. So here we can see the overlapping in dorsum of foot. S2 is overlapping. Then in this diagram also we can consider S2 is covering the same buttock region, and then going down posterior thigh, posterior leg, and some part of this foot. So S2 we can see anteriorly some part of here which is coming from, like posteriorly it will be the buttock region, which we appreciated over here. As S1 the buttock region will be covered by S2, and here some part of groin has been marked. So mainly buttock, again the thigh portion, posterior thigh, posterior leg portion, and some foot portion will be covered by S2 dermatome. So S1, S2 are basically the same thing, which can be differentiated this way, but we can see that it is posterior thigh, posterior leg, and same way the foot portion can be seen over here, which is overlapping. So that is about S2 dermatome. Then S3 dermatome. So S2, S3 over here in this diagram we can see S2, S3 are overlapped. So mainly they are considering that groin region is covered by S3, can be appreciated over here. See, so posteriorly or anteriorly we can see over here S3, the groin portion is covered, and then medial thigh to knee. So this is somewhat coming to medial side, the S3 portion. Okay, see, it is coming from here to the medial side to cover the groin portion, as well as going down to medial thigh towards knee. So over here, now this is only the anterior view. So you can see over here it is covering almost the medial aspect of the thigh to posterior, so medial thigh to knee. It is just that. Over here you can see how is it going from medial thigh to knee. That was about S3 dermatome. Then coming to S4, which will also cover perineum, we know that. So it will have genitals and lower sacrum at the back part. So that is in posterior view, we can say the lower sacrum area, perineum and genitals will be covered in S4. We can see marked up over here, S4. So genitals and the perineum portion along with the lower sacrum can be seen over here also. So that was about lower limb dermatomes. We understood which area is covered with what dermatomes, what part of skin is supplied by which nerve root. Now let's discuss about the clinical aspect. So as in upper limb dermatomes, we discussed about cervical radiculopathy, or there when the nerve is getting impinged, it can affect, how it can affect it. So here we will discuss about lumbar radiculopathy. So we can see when the disc is herniated, it will, or protrusion of disc is there, it will impinge the nerve entrapment will be there, and whatever part this nerve is going to supply will affect that part of the skin. Patient may present with pain, numbness, or abnormal or altered sensations can be seen. So if the L3 dermatome is affected, as we had discussed, so we can see how along with the back portion coming over here, the anterior part of the thigh will be affected. Then L4 more little down, it will descend down. L5 will trace this path, and S1 we will have this path. The same thing is compared over here. If seen in anterior view, we can see L1 is the upper portion. We discussed the trochanter. In posterior view it will be the back portion also, and over here the trochanter. So certain parts over here, and then L2 little down, so you have to just go down in oblique manner. So if L2 is affected, it will involve this area of the skin. Then we can see L3 as shown over here. Then coming to L4, L5 and S1. Again, if we compare it with the diagram, so L1 we saw, L2, L3, L4, L5 and S1. So we have to just go obliquely and descend down to remember those dermatomes. So if we check for sensations in this part over here, and if we find something abnormal, then we can come to conclusion that L2 dermatome is involved. But if we are testing this portion, it is normal. But altered sensations we can find over here, so that means L2 dermatome is involved. So in previous series, we had learned that how to test those dermatomes using light touch, using pin prick for pain sensation, using cotton to test light touch, and so on for temperature, vibratory sense, etc. So that way we can remember. So this was an example. Another again we can consider over here. So in first picture, the upper one, we can see L4 nerve root is involved or affected. So below L4 vertebra, L4 nerve root will emerge. So if L4 nerve root is involved, then we can see the L4 dermatome here anteriorly marked with red. So that will be affected. Posteriorly, this part will be there, the upper or the buttock region, this one, and upper part of the buttock region. As we can see, if we compare the L4, as we had seen, the medial part of the buttock is also involved, as well as the lateral thigh and medial leg and dorsum of foot and big toe. So accordingly we can compare over here, all those parts are affected. So your medial part of buttock, dorsum of foot, and this part also, the thigh portion till knee is affected. If L5 dermatome is affected, that means the nerve root which is coming down below the L5 vertebra will be L5 nerve root. If that is affected or involved, then you will have pain, numbness, tenderness, or any other altered sensation in this particular area which is supplied by L5 nerve root. So specifically, these areas are already marked in these pictures, can be clearly seen. So now here this portion is L4, then L3, then L2, and then L1. So this below that is L5. Now in below this portion remaining, the remaining portion over here can be seen marked over here, as in this the S1 nerve root is involved. So part supplied by that will be affected. So this is in the anterior view. Similarly, this is posterior and then the lateral view. So we can see here the L5 part is there, the foot and the buttock area. Over here, which part of thigh and lower leg and all are involved. Then in S1 nerve root also we can see, those we can compare from here. So as we discussed, from L4, then L5, and this part as S1. So that is affected. So now here, as it is already marked that which nerve root is affected. But now if you are testing, there are three cases, there are three patients, A, B and C. So if you are testing, in one patient you are getting altered sensation somewhere over here and here, for example, then you will come to a conclusion that L4 dermatome might be involved, or L4 dermatome is involved in this case. In another patient, you may find the altered sensation in this portion. So, L5 dermatome is involved in that patient. And in third patient, we can see the numbness or pain is in this portion of the leg thigh. So, you will conclude that S1 dermatome is involved, or S1 nerve root is involved. So that was the example. Over here also we can see L5S1 disc herniation is shown, which is causing some problem. So we can see here L5 nerve root, which is supplying this portion, can be seen in this part. So which is supplying this portion, lower leg, lateral lower leg part is being covered. So, and also the buttock portion, and here posterior lateral thigh is involved, so that will be affected. The sensations in those parts would be affected. Similarly, if it is for L4, here it will be affected, and in S1, as we had seen the posterior view, this part will be affected. So the same things are just shown over here. This is the best example to take. If we test and find some altered sensations, then how to conclude which dermatome is there. So that was it for series 4, where we are stopping the discussion of lower limb dermatomes, and this way the dermatomes topic will get over.